Thank you for listening to Depictions Media Radio.
Thank you and good afternoon. Today we have a total of 559 new cases of COVID-19 in British Columbia, 29 of whom are epidemiologically linked cases, bringing our total number of people with COVID-19 to 77,822. Of the new cases, 132 are people in the Vancouver Coastal Health Region, 278 people are in the Fraser Health Region, 39 are people in Vancouver Island Health, 43 people live in the Interior Health Region, 66 people are in the Northern Health Region, and one is a person who normally resides outside of Canada. We are now up to 4,677 active cases in all health authorities across the province, of whom 238 people are currently in hospital, 69 of whom are in critical care or ICU. We have an additional 7,881 people under active public health monitoring, and 71,753 people have recovered now from COVID-19. In the last 24 hours, we've had a single person who has died from COVID-19, bringing the total number of people we have lost in this province to 1,336. And our condolences, of course, go out to the family of this individual in Vancouver Coastal Health and to their community and care providers. Our thoughts are with you during this very difficult time. We have no new healthcare outbreaks, and the outbreak at the Abbotsford Regional Hospital is now over. That leaves us with 12 active outbreaks in long-term care and assisted living and 5 in acute care units. And that includes 415 residents and 218 staff now involved in outbreaks in long-term care. And if we look at these numbers, today we have had no new cases in long-term care or assisted living in the province, and we had no deaths in long-term care in the last 24 hours. The single person who died in the last 24 hours was in an acute care facility. This really is a reflection of the vaccines that we have had and their use and deployment to long-term care and assisted living across this province. It really is remarkable that the effects of even a single dose, and we saw some of that data presented last week by the BC CDC that has shown the vaccine effectiveness after a single dose in residents of long-term care and in healthcare workers who've received that vaccine is upwards of 80% within 2 to 3 weeks of receiving the vaccine. This is a success that we need to appreciate and celebrate, even as we are preparing now to be able to provide more vaccine to more people in our communities. Since the start of our immunization program, 287,950 doses of COVID-19 vaccine have been administered everywhere in British Columbia. That in itself is an amazing feat. And 58,896 people have received a second dose. Most of those people are seniors and elders in long-term care. Related to this, we have, as we report on, we have a very good monitoring system to ensure that we capture anybody who's had an adverse event after immunization. We've now had 292 AFIs, as we call them, reported related to COVID-19 vaccines, which equals, and about 19 of these are anaphylaxis or allergic reactions that have been treated in the clinics or in the places where immunization was provided. That is something that we have seen across the world with COVID vaccines and with all vaccines, and we are prepared in our immunization clinics to make sure that we can handle these. We have about 10 in 100,000 doses that have led to these types of reactions. I think it is a moment to reflect as we are starting to receive increased supplies of immunizations over the next coming weeks, that we have delivered all of the vaccines as they've arrived. And it's been challenging in these last few weeks where we've had a very limited supply, but we've been able to use the vaccine that we have had to address some of the urgent outbreaks that were happening in our communities, in our long-term care homes, but also in our acute care facilities. And as we continue to ready our province for these widespread mass vaccination, these mass immunization clinics that we are doing a lot of work to get ready, they will begin in the next few weeks for people based on age as we're starting this. We are moving forward and doing a lot of work behind the scenes to make sure that the systems in our health authorities across the province, we have the tools and the resources to take on this incredible and significant task. And we have not spent any time wasted over the last few weeks making sure that we are putting all of those pieces in place and connecting with communities, connecting with arenas and community centers and schools and places where we will be providing immunization in communities and engaging with communities so that we can be in this together to provide this vaccine. As part of this, I have issued a PHO order to allow a number of health professions and occupations to work in our immunization clinics with appropriate training, of course. So this means we've expanded our pool of immunizers and people who can provide services to include dentists, midwives, pharmacy technicians, paramedics, retired nurses, and a number of other professions. So we are very excited to be able to have the workforce that we are going to need over the next 6 months to ensure that we can get vaccine into as many people as wanted in this province as efficiently as possible. We also need new systems to manage this process. As we have said from the very beginning, it's incredibly important that we have the ability to know exactly what lot of which vaccine goes into everybody's arm. This is for individuals so that you know which vaccine you got when the second dose comes up. But it's also a really important part of our understanding of safety monitoring for each vaccine. And as more vaccines come online, as we expect them to in the next few weeks, this will become even more critically important. But also, we want to make sure that we have a seamless ability for people to register, to book their appointments, to get their immunization, to have that recorded in our central provincial registry so that it's available to you, to your healthcare providers in the future, and also to be scheduled for your second dose when it comes up. This is important. Without a doubt, there's going to be some hiccups and some bumps, but we are working hard to make sure that we can make it as seamless as possible for everybody, starting with the people who are most at risk. But it is important to know that everybody over age 18 right now who are eligible for vaccines will have access. Nobody will be left behind. We will be finding you from various different ways, whether it's reaching out, as we are starting to do in the coming weeks, through understanding people from our MSP lists and through specialty clinics, through family physicians and others. In parallel with more vaccine increasingly available, we are now turning our focus to people over age 80 in our communities around the province. These seniors and elders will receive vaccine information in the next 2 weeks. So please be patient. We have not forgotten you. These plans are in place, and we will be reaching out to you in the coming days and weeks. And we'll be sharing more details, as Minister Dix indicated, on Monday, when we have more of the exact details for everybody worked out in the coming days. As part of our current efforts, however, to manage this pandemic as we're moving into this very exciting and positive phase, we are paying close attention to what we're calling variants of concern, and I know that has been an issue, particularly in the last couple of weeks. And we need to understand the effects that these viruses, these variants, have on our transmission, on events in our communities here. And over the past 2 weeks, since the beginning of February, when we put in place extensions of the orders that we had in place, part of the reason to do that was because we did not know how many of these variants we were seeing, what proportion of our cases were being affected, how much transmission we're seeing in our community. So that has been a focus over the last few weeks, to understand better what the impact is or will be or could be from these variants of concern. We have been monitoring closely. We've been increasing our screening. Initially, we were able to do whole genome sequencing on a small proportion of cases over time, about 5%. And our labs have been working full-time, and they've developed what we call a screening test. So when we do the initial PCR test, it detects the RNA from the virus, but we need to do another test. It's called a SNP, or single nucleotide protein, that targets specific variants, parts of the genome that we're concerned about that are associated with these variants of concern. And the main one we're looking at is the N501Y, and you may have seen that in some of the scientific documents. And that is the piece that we believe is associated with the mutation of the spike protein that leads to increased transmissibility. So that's one of the pieces that we're most concerned about. So we now have the ability to screen about 70% of our positive tests every day for this variant, for this mutation, and that allows us to screen out which ones are most likely to be a variant of concern. We did this in what we call a point prevalence study, and I mentioned this last week, but just to reiterate, on 5 days at the beginning of this month, we screened every single test that was done. It was that was positive, so it was about 3,099 of them with this special SNP, and it picked up 30 that looked like they were a variant of concern. And then we did whole genome sequencing on those. Whole genome sequencing is a bit more labor-intensive process, and we have limited capacity of about 500 to 700 a week, and though we're increasing that as well. So being able to screen out ones that don't have any of the worrisome mutations allows us to focus on the ones that are most risky. So that screening test is done right after the PCR test turns positive. So we get that information much more quickly, within a day. And now that is being provided to the public health contact tracing teams in our health authorities, so they are able to more rapidly follow up with people who have what might be a variant of concern. And then we do whole genome sequencing on those. Of the ones that we did a couple of weeks ago, the 3,099, 30 of them screened positive with this screening test. And of those, 3 turned out to be true variants of concern. 2 of them were the UK, the B117, and one was the B1351 associated with South Africa. So that, 131 associated with South Africa. This is some of the things that have been going on in the background as we try to understand the impact that these new variants that we have seen, the impact that they have had in countries, other places in the world, and in other parts of Canada. So this past weekend, as we all know, there were a number that were identified, but they were identified over a period of weeks. So this is still part of our catching up on understanding which cases are associated with these variants of concern. And the cases were identified over the weekend were in a batch that covered several weeks. As we had said before, because we are doing extra testing on school-age children particularly, even though they were reported at the same time. All of these cases are followed up by all health authorities. The majority of them have been in the Lower Mainland, in both Vancouver Coastal and particularly in Fraser Health. And we are paying extra attention so that we better understand where and if these are spreading, particularly in environments that are so important like our school systems. So we're not doing things differently, but we are doing paying attention so that we better understand the impact that these are having in our communities around the province. We know that the school exposure, we're doing extra testing. We started that with the concern that we had earlier in Garibaldi, where no other people in the cohort tested positive. And I know Fraser Health is working in the last few days. The initial tests came back. So far, I understand that there has been the potential for one rapid test to be positive, and that one is being confirmed. And Fraser Health will be having more details about these in the coming days. So really, this is important for us to understand where we are in the trajectory and what the potential is for increasing cases. It is concerning that we are seeing an increase in percent positivity and our 7-day rolling average of cases in particularly again in the Lower Mainland. But viruses do mutate and do change, and this is important for us to monitor. We saw this early on, and we can continue to see it today. But for most of us, public health is paying attention with the work that we do in contact tracing and making sure that we are connecting with close contacts and doing extra testing, as we have been doing all along. However, right now, for the rest of us, it means that we have to continue to pay attention to the very same things that have gotten us this far in this pandemic. And that means paying attention to staying home if we're not feeling well, to getting tested immediately if we have concerns or if we've been in contact with somebody who has concerns. Making sure that we wash our hands regularly, cover our mouth when we cough, wear masks when we're in indoor public spaces, and following our COVID safety plans, whether it's at work, at school, or whether you're in the healthcare system. We are holding steady in this past month. This uptick that we've seen in the last few days is one that we are managing as aggressively as we can to understand better where we are. This is in contrast and balanced with the positive news that we have about how effective these vaccines that we have are working in our long-term care homes, in our healthcare system. And we're learning about the impact that these variants of concern can have. But we know what to do to manage these, and we can and will do it. We are in a period of what I'm calling vaccine hope and pandemic reality, and our focus has to be to hold steady, to support each other to get through this part of our marathon, our storm, even as it becomes more and more challenging. We know that there's more vaccine that's coming. We know that we're ramping up and we're ready to go to protect more people in our communities. And we know that we have the tools and know what to do to keep this virus in check. And no matter where we may be or what we're doing, we can get through this by being kind to each other, by remaining calm and keeping safe.
Thank you very much, Dr. Henry. And just to start, I wanted to pass on my condolences to the family, the friends, the caregiver of the person that passed away in Vancouver Coastal Health from COVID-19 in the last 24 hours. It is a difficult time to feel loss, and for the 1,336 people who have passed away during the pandemic, and for this person and their family and their caregivers yesterday, we have to hold them in our hearts. And we wish provide all our support that we can to the families involved. I just wanted to clarify a couple of the vaccine numbers. The number I think that Dr. Henry used was 287,950. That's the number of doses that have come to British Columbia, including approximately 45,000 doses that have just arrived of Pfizer vaccine. The total doses administered is 224,354. 165,458 people have received first doses, and 58,896 have received second doses. That latter number is growing. And Dr. Henry talked about this, but it bears, I think, repeating. You saw some of the numbers that were released late last week with respect to by care home, by assisted living residents, with respect to immunization. Just to say, as of now, in long-term care residents, 92% have received their first dose, and a further 39% in total have received their second dose. That's 28,430 have received their first dose of COVID-19 vaccine, and 12,197 have already received their second dose. Among staff in long-term care, it's 94%. That's 36,623, and a further 52% have received their second dose. That's 20,434. In assisted living, the same, 9,489 residents have received their first dose, 2,254 residents have received their second dose, 4,969 staff their first dose, 1,328 staff their second dose. And so what the numbers show, which on January 15th, you recall, were 49 outbreaks in long-term care and assisted living in BC, are now here on February the 23rd, 11 outbreaks in long-term care and 1 in assisted living. And so what that tells us is that, first of all, the work done everywhere by our public health officials in immunizing in long-term care and immunizing in assisted living has been truly extraordinary, given that they're new vaccines. The uptake, the lack of hesitancy amongst both residents and staff is, I think, worthy of note and a very positive fact. But overall, it's their effectiveness that matters and should give all of us confidence that when our turn arrives, that the vaccines, even in a population that is absolutely vulnerable from a health point of view, that the vaccine is effective for them and it will be effective for others. I note, and you'll know, that next Monday, Dr. Penny Ballum, and Dr. Henry and myself will be presenting the immunization plan, particularly as it relates to people over 80. And obviously a lot of work is going on to deal with the mass immunization clinics now. We're talking about 172 sites across BC. We're reaching out, we're connecting with people. Dr. Henry talked about authorizing new classes of workers to work in those campaigns today, and it very much follows, as it has step by step, the plan presented in January by the Premier and by Dr. Henry and Dr. Ballum at that time. Over the coming weeks, a couple of weeks, starting next week, we'll be focused in terms of all the groups that we've been working on so far, but also people who receive home support, public home support, people who are in independent living, and so on, adding to those lists of people in those categories. The approximately 24,000 clients will be in question over the next 2 weeks as we prepare for the more general immunization, which will start in the middle of the month. We'll have more information on that on Monday. I wanted to say just finally that Dr. Henry, I think, said it very well, that we're at an important moment in the pandemic. We have vaccines, but as I've said a number of times in the last week, the amount of vaccine being provided to us is being delivered and being delivered week unto week. So our staff is doing, I think, an excellent job across the most vulnerable groups in delivering our immunization campaign so far, and that should give us confidence about what is to come. But it's also a challenge right now because we see transmission on days between 500 and 600 cases significantly in Metro Vancouver. And that's why we have to not stop right now. We don't stop using the skills we've been taught to stop the spread. Don't stop taking the care we take that saves lives. Don't stop showing each other the compassion we do that keeps us safe. Don't stop what we've proven works. Our BC fight is about turning the uncertainty of these times into achievement and reducing transmission. That's what we do, and we can't stop now. Aujourd'hui, nous annonçons 559 nouveaux cas qui ont testé positifs pour COVID-19 pour un total de 77 822 cas en Colombie-Britannique. Nous sommes attristés d'annoncer un nouveau décès lié au COVID-19 pour un total de 1337 décès en Colombie-Britannique. Nous offrons nos condoléances à la famille de cette personne, mais aussi à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19 en Colombie-Britannique, 238 personnes sont actuellement hospitalisées, dont 69 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone line, please press star 1 to enter the queue. You are limited to one question and one follow-up only. I would also ask that you please take yourselves off mute. You are not audible until your name is called. First question today is from Vaughn Palmer, Vancouver Sun.
Good day, Minister, and good day, Dr. Henry. Fraser Health has advised doctors and clinics in the region that the goal is to have mass public clinics up and running starting April the 6th. Is that also the target for the whole province, and what hurdles still need to be cleared to get there?
Yeah, so that is the bigger clinics that we're having in the 172 communities, and we'll be talking, as Minister Dix mentioned on Monday, more details about that. But in the meantime, we are targeting people who are 80 and above, and they'll be slightly different. Some of them will be the mass clinics, and some of them will be tailored more to the people that we're targeting in that group. So many of them, many of our seniors are people who live in independent living or receive home care, and so we're doing a mixture of making sure that we can get to our most elderly people as efficiently as possible.
Vaughn, do you have a follow-up?
Yes, please. Fraser Health is also saying, and you referred to recruiting people as immunizers. Fraser Health is saying that at the peak, clinics will require as many as 500 immunizers per day, and they're also saying that they expect the uptake of the vaccine will be in the 80 to 85% range. Are those numbers sort of ballpark for the whole province? And in terms of implications, how big a recruitment drive are you going to be into on this if that's the case?
Well, that gives you some indication of the scale. And yes, we are looking at, we have run mass clinics before, and this is going to be a big scale, at a scale that we've not done in many, many years. And it will be prolonged. So this is not something that's going to just take, I think back to 2009 when we had the influenza pandemic and we had mass immunization clinics and provided vaccine to millions of people within a very short period of time. This is a different goal here. It's more people, it's a broader swath of the population over the entire geographic area with vaccines that are fussy. So yes, we are looking at, those are some of the parameters that we've been planning towards in all of the health authorities to get these clinics up and running. And yes, we are looking at large numbers of people, which is one of the reasons I put the order in the last today about being able to recruit people to work over time in these clinics to provide different functions. So there's a whole lot of things that go into a clinic besides just putting the vaccine in one's arm. So there's a lot of things that, whether it's registration, whether it's making sure that we have people, especially if we're talking about our frail elderly and older people coming into clinics, having somebody to make sure that the experience, they're able to support them going through the clinic, people monitoring afterwards for adverse effects, and those are all the things that we've been planning for in great detail over the last number of weeks. Yeah.
I think I noted this when I was describing what's happened to date. I think that very effectively we've addressed some complex situations. It's and the health authorities, including the First Nations health authorities, have done, I think, a very good job so far of addressing the situation in long-term care and assisted living in hospital circumstances, in dealing with some emerging situations in communities, in going to rural and remote Indigenous communities and providing support from Nishka to Hartley Bay, all to Cowichan. So in all of those cases, the effort by health authorities has been, I think, excellent in dealing with some of our most vulnerable populations in the province and providing them with care. We're entering into a new phase. This is what Dr. Ballum has been leading, working with Deputy Minister Steve Brown, with Dr. Bonnie Henry, but then thousands of people will be involved in this. Indeed, I'd argue tens of thousands of people will be involved in this immunization campaign in the coming months. And so those are the details we'll be providing. With respect to whether one health authority is different than another, there are different circumstances in the north where populations are spread out and more isolated than they are in large metropolitan areas that are represented by Fraser Health. But basically, the core of it will be the same province-wide. And the work is being done now to prepare for that. We're identifying the sites, and over the next number of days, you'll hear from different municipalities who've identified particular sites. I think we heard from Surrey yesterday. We might have heard from Langford last week about sites that have already been agreed to. But this is going to be an extraordinary campaign. What you're going to see in the next 2 weeks that's a little different from March 1st to 15th is particularly in dealing with people who receive public home support is an effort also, and this will be required with certain groups of people and a subpopulation of the people over 80 who we need to reach in their own homes or in their own residence. And so some of that work will happen now. So we continue to focus on those groups, and we'll have the broader information that Dr. Ballum will be presenting with our support next Monday.
Next question is from Shannon Patterson, CTV.
Oh, hi there. In Alberta, starting tomorrow, hello? You know what's my question? Can you put...
Stand by, Shannon.
Okay.
Ladies and gentlemen, please stand. Ladies and gentlemen, please continue to hold.
Okay, we're back. Sorry, we had some technical difficulties. We will go to Shannon Patterson, CTV.
Oh, hi there. Hope we're okay now. In Alberta, starting tomorrow, residents 75 and over are eligible to be vaccinated and can book their appointments for both doses, so their booking system's already up and running. We won't even learn about the process for our over 80s until next Monday. So my question is, why are we behind Alberta?
We have a different program than Alberta, and there's a number of issues around that. Partly, we have a different epidemiology, and we have a different demography here in the province. They have much fewer seniors over the age of 75, over the age of 70. So they have tailored their program to their circumstances, and we're tailoring ours to our circumstances. And our focus, the focus has been the same in terms of protecting those who are most at risk because of age. But we need to use the doses that we have and the population that we have and tailor our programs to our both geography and demography here in BC.
Shannon, do you have a follow-up?
I don't know if you've seen the Liberal health critic came out today publicly being quite critical of the lack of public information on the vaccine rollout. You said now there will be a press conference next Monday to at least unveil what will happen with people over 80, but other provinces have released some or part of their plans much earlier. So why not give out more information as you know it to keep people in the loop as the process goes along?
Yeah, I think what you'll find is that we did tell you in as much detail as we knew the basis of the program. It has not changed. We are doing it focused on the number one risk factor with the vaccine that we have. And I think all of us across the country were thrown for a bit of a loop when our vaccine dried up for a few weeks. We've been using that time to put our systems in place, to get the lists of people, to make sure that we know exactly how and who we can reach out to, and we're providing that information as we go along. And it's been a challenge for all of us, and I think this is a grand scale. The other thing that we have to focus on is, we have been using all of the doses of vaccine we have to make sure that we are protecting those most at risk in our long-term care homes. That was our number one focus, and that we've seen has been incredibly positive and a huge relief for many of us, both in public health, but all the families who have people in care homes. We've also been addressing those outbreaks that we're seeing in parts of our community, in our acute care system, and making sure that our acute care system as well is protected so that we can provide care to everybody. So, these are things that take time, and now that we are starting to receive vaccine again, and we've got the building blocks in place for the foundations of our program, we will have those details for people.
Just say that in January we laid out in detail, we briefed media, we briefed the public, the vaccination plan was available, and we have executed that plan. And I think our public health officials, but our staff have executed that plan extremely well. There are occasionally stories of problems here and there, but in general, to have delivered in long-term care, in assisted living, to healthcare workers, to First Nations, to vulnerable communities living in congregate settings, to community care workers as we have, and to have done it in detail based on a plan that we laid out in advance is a real achievement. Now the next challenge will be even greater, but you made the comparison to Alberta. We have administered our vaccine, almost all of it. We received a little more yesterday, and now we'll be able to ramp up immunizations more in the next 3 days than we did in the last 3. But the vaccine proportionally comes in the same proportion of Alberta, and we're using all of it, which tells us how effective our campaign has been here. In Alberta, I think they're doing some good work as well. So it's not a race, but in terms of the share of the vaccine that is going into people's arms, we're delivering all of it, and really in a way that I think British Columbians can be proud of, protecting those who are most vulnerable, exactly as we presented in January. And now that we're ramping up to a different campaign, a more broader community campaign, there'll be more information, and we'll be providing that next Monday.
Richard Zussman, Global News.
To stay on this theme, and I understand we'll get more information on Monday, but one of the things I hear most from families of those over the age of 80 is how can you assure them that they will be notified and how that notification will work? So can you provide some clarity for those people waiting in terms of how they will be told it is their turn?
Yeah, there'll be a whole variety of ways. We recognize that not everybody who's over the age of 80 and living at home or in community or in independent living has the same access to things like the internet or phone call or the ability to make those types of phone calls on their own. So we are tackling it from a number of different ways, whether that's receiving a postcard in the mail, which some people will, whether it's getting access through the home care services that you are being provided, whether it's through your specialty clinic that you're involved with, through the independent living facility that you live in. Those are all ways that we will be reaching out in the coming days and weeks to seniors in the community. And we will be making it abundantly clear and appealing to our community members. If you have a family member or a friend who is struggling, who doesn't know exactly where to go to find out the information, that you can support them as well. But we want to make sure that it's seamless. If we give out a number, for example, we know that it's going to be, a lot of people are going to phone it right away. So right now we want to make sure we have all of the systems in place so that we make it as easy as possible, particularly for our seniors and elders. And I know many in my life are very anxious to find out when their appointment is going to be, and you will get that soon. We want to have everything in place so that it is as smooth as possible. Having said that, I know that there's going to be glitches, there's going to be bumps. We will not let people be let behind. We will be reaching out to you, and we will be making sure that you get what you need as soon as we can.
Follow up, Richard?
Yeah, I'm wondering why there's been a delay in second dose vaccination slated for Cowichan tribes, especially after there was another death report in the community this week.
Yeah, I think we have been working with the Cowichan Nations, with Island Health and First Nations Health Authority. This is a very frustrating and ongoing outbreak that's been happening in this community, and it has been tragic, particularly in young people. So we have been working very closely with them around where immunization is best delivered to whom, and how do we manage this as the crisis that it is. And there are many things that have been going on to support the Cowichan community, and we will continue to do that. I know that First Nations Health Authority is working with the nations and with Island Health to make sure that not only are we providing second doses to those who need it now that we have vaccine, but that we're able to use immunization to help manage this very challenging and tragic outbreak.
Next question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry and Minister Dix. I was hoping you could talk more about the security of the vaccine rollout, because we've heard so much about people that may be trying to sabotage or terrorists trying to get their hands on it. Is that part of the reason why we're seeing so much secrecy about the plans being rolled out, that you need to make sure that whatever partners you enlist are going to be safe?
Not specifically, no. It is an underlying concern, and we've been working with our national colleagues at the NOC, the National Operations Center, about immunization and vaccine delivery. They provide us with routine security updates. There are different pieces that need to be put in place, and I don't actually believe that we've been secretive about this. It's been a matter of health authorities identifying places in the community where these can happen, identifying, and we've reached out to many community groups, and I think this is a really positive thing. We are going going to have immunization clinics in our communities around the province, and all of us need to be involved in supporting that, making them work. It's going to take time, and I look at Scotland and the UK and the way that they've rolled it out. We've been talking with them, understanding the issues that they encountered, or particularly early on, and how to engage people. And I think this is a really positive, exciting opportunity. We are seeing our way out of this pandemic, and part of the reason that we're doing that is because we now have a really effective vaccine that works in older people, which is quite something that those of us who have been working in immunization for many, many years are really find miraculous. And this is a really positive thing. And we're just trying to get all of those pieces, those moving pieces together, and they are coming together. And this is going to be an incredibly positive move for all of us in the next few months to get through this. And at the same time, we have to manage the pandemic that we are still living through right now. But in the coming months, we're going to be able to do all those things that we have been missing for the last year. And by the time we get to the summer, we're going to be in a different place, and it's going to take all of us working together and being patient and supporting our neighbors and supporting our elders and seniors in our lives to get this going in the next coming weeks. And I'm going to be there as the biggest cheerleader, because this is what is going to get us out of the pandemic that we are in right now.
Marcella, do you have a follow-up?
I do, and it's more about the education system and concerns being raised about why aren't individual school districts or individual schools allowed to set their own rules when it comes to what assurances can be made that safety is a priority. And we had some discussion about this yesterday with Dr. Gustafson, but can you give us any kind of insight into what changes could be coming if these variants take hold, and will school districts be allowed to adapt accordingly depending on how hot the variant is in a particular area?
Yeah, so I think if we look at how we have set up the safety plans for schools, this is a team approach. And we have the public health guidance that we have sets a standard. And then it's adapted by the school superintendents, by the principals, by the teachers in each individual school, depending on their physical layout, everything from ventilation to the numbers of kids in the classes, the types of classes that they have. So it is individually tailored with the provincial sort of backbone of the guidance that we have. So there is absolutely flexibility, and I know the superintendents in Surrey School District is a really good example, has been working closely with each individual school, with the teachers, the principals in those schools, and with public health from Fraser Health, the school health officers, to adapt and adjust the plans. And we know as well that when the safety plans that are in place in these schools are being followed, that they work. We have had a cluster of exposure events, but again, very little transmission so far. And that's why we're doing the extra testing, to be reassured on this. But so far it does not look like there's significant transmission from these variants, which is really good. It shows us that the safety plans in schools are working. And yeah, it is concerning. That's why we're watching it so carefully and we're paying so much attention to it.
We have time for one more question this afternoon. For everyone listening, Dr. Henry Minister Dix will release a statement with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question today comes from Marc-Anthony Boulanger, CBC Radio Canada.
Hi, Dr. Henry. Can you hear me?
Please go ahead.
Cool. Dr. Henry, so we asked this yesterday, but we're still trying to get around with the clear answer. I know you just touched on it, but can school districts start implementing their own COVID protocols in the classroom, like mask wearing in the elementary schools if if they deem necessary, and without waiting for you or the province to mandate it? And if not, why not when teachers and families are asking for the province and for you to steer away from one-fits-all approach for all classrooms in BC? If an answer can be provided in French for that.
So again, it goes back to we provide the guidance, and it is up to each school to work with their local situation, with the teachers, the principals in those schools, and the guidance is not developed in isolation. We have teachers, we have parent groups, we have superintendents. They meet on a regular basis to develop the guidance and the advice that's given to individual schools, and then they work with their local school health officer and address the situations that are unique to their schools. And absolutely, it is important for teachers to encourage mask use where it's appropriate in classrooms. And, these are the things that are individual classroom and school-based. And I just have tremendous respect for the vast number of educators in our system who are making this work and providing a safe environment that is so important for the growth and development of children. And we've seen that more and more, how important in-classroom schooling is for our next generation, and the importance of keeping that up and making sure that we can do it in a way that's safe.
Premièrement, il faut dire que les règles, les conseils, la direction dans des écoles n'est pas développée en isolation. En fait, il y a beaucoup de monde qui y participe, y compris les enseignants, y compris les dirigeants des écoles, y compris les conseillers scolaires, etc. Donc, on travaille ensemble pour assurer que des gens dans nos écoles sont sains et saufs. Et je pense que ça, c'est la chose essentielle. Bien entendu, il y a les directions de la santé publique qui doivent être suivies, mais les efforts dans chaque école sont menés localement pour des raisons importantes, parce que chaque école n'est pas la même école. Ils sont différents, et donc il faut développer des règlements différents sous les mandats de la santé publique. Donc, je pense que c'est important. C'est pour ça que je pense que, finalement, il faut ajouter que je pense que les enseignants Colombie-Britannique, les professeurs, les gens soit dans les salles de classe ou qui travaillent avec les gens dans les salles de classe font un travail extraordinaire dans notre province. Et je pense que le travail mené par la santé publique dans chaque registre de santé, en travaillant avec les conseils scolaires. Je pense que ce travail, c'est un travail important qui fait en sorte que nos étudiants, nos jeunes vont à l'école, alors que dans plusieurs autres juridictions, un peu partout dans le monde, c'était interrompu. D'être à l'école, c'est important pour nos jeunes, et ça fait partie de notre détermination depuis le commencement de l'année scolaire.
Do you have a follow-up?
Yes, and back to vaccination, modeling from SFU is suggesting that BC's vaccine priority list should not be age-based and should instead focus on high-contact essential workers, so like grocery store workers, servers, teachers. So if we want to avoid a massive spike in cases and also keep the businesses and the schools open. So any thought to this maybe being given to changing the vaccine priority schedule? And if not, why?
Yeah, the short answer is no. We are well aware, and we're happy that Dr. Cotin has been involved in some of the modeling that we've done as well. But we are absolutely confident in the marrying of the vaccine that we have now with the risk that we have, which is age-based. And I think that's been absolutely supported across the world, but definitely looking at what we have and how we can best protect people. We have goals in this pandemic, and our goals are to minimize morbidity or mortality and to minimize the impact on society of the pandemic. And the primary goal that we have is to keep our healthcare system functioning and to protect lives right now with the amount of vaccine that we have. I do absolutely agree that there is a role for immunizing both essential workers and people who cannot work from home, who have higher contact rates, and this is one of the inputs that they've been using in the modeling, and we've looked at that as well. And that is an important piece that we are looking at a different point. So once we get to a certain part of our age-based program, that is the core of what we're doing, and we have enough vaccine, we will be looking at how do we do that effectively. And if you look at our program, we've talked about there's a bar underneath phase 3 phase 3 and 4 that talks about essential workers and people who cannot work from home. And we are looking at how do we do that in a way that maximizes the suppression of transmission and protects enough people at the right time. So, modeling is one way of helping us look at one scenario versus another, and there are many different inputs that go into it. So we take those into account and we factor them into a number of decisions that need to be made, but they don't tell you exactly what to do. What they give you is a sense of what could happen if you do one thing versus another. So yes, we absolutely pay attention to these and we factored them into how we approach the programs, but we are confident that the approach that we're taking right now with the vaccines that we have right now is the best approach for BC.
That's all the time we have today. Thank you.
Thank you.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.